Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Information Officer, and tonight we're going to provide an update. And we also have a special guest with us tonight, Dorotha Ferraro with South Peninsula Hospital. She is the Marketing and Public Relations Director for the hospital. She's also serving as an information officer in this response. We're excited to have her. I also want to turn it over to Dan Nelson, our incident commander, for today's update and additional words. Good evening, Dan.
Good evening, Brenda, and good evening, everyone. Thank you so much for joining us this evening. I'm just going to do a brief update so we can get on with some more discussion with our guest. But another good day here at the Kenai Peninsula Borough, and coordinating with all of our cities and response partners. We continued some alternate site planning and some assistance to healthcare and hospital facilities throughout the peninsula. As well as continued coordination and preparation for the response as this event continues. So we don't have any new cases of positives to report. We do have a total of 119 cases in the state of Alaska, as announced this afternoon by the Department of Health and Social Services. We continue to work on some community outreach and some community engagement type things that I'll hopefully be telling you about the next day or so. But we've added to some of our what we call our operations section of our team response, and have brought in some additional expertise in incident management to help coordinate a lot of the things and the community ideas and needs that may be coming into play here now and in the future. So those discussions and that strategic planning continues. With that, our team is really kind of just getting into that mode, and our continuous response of making sure that we have a good incident response, as well as making sure that our borough operations remain successful. And we had some good discussions this morning with our borough leadership, and doing a check-in, and it sounds like the remote work options and remote service options to our community members are going well. So I do just want to encourage some folks we know don't always have good internet and don't have access to different things of our online services, and be sure to know you can also call any of our borough facilities, and somebody will help you get the assistance you need, whether it's doing something over the phone. If we need to do paperwork, we can get that in the mail to you if you don't have some of those online options. So really a lot of things happened today, a lot of going from A to B to C, but I think really a better conversation is with our guest, and we've been working with South Peninsula Hospital and all of the hospitals here in the Kenai Peninsula, and really been a pleasure to get some of these plans together and these things that we've exercised over the years. Now is the time we're putting them to good use. So that's my update for today, but I'm sure if we've got questions on that, I'll be happy to address them later in the video.
Thank you, Dan. We are definitely excited to have Ms. Dorotha with us tonight. And she, along with her team, have done some outstanding things on the Southern Peninsula. Ms. Dorotha, are you with us?
I am here. Thanks, Brenda.
I'm going to let you give us a detailed introduction and your position on the team.
Okay, great. Thanks. Well, I am, as you said, the Director of Marketing and Public Relations, but for the COVID-19 event, I am the Public Information Officer, and it does take a team, just as the borough uses a team. We use a team as well, but I'm the lead PIO. I've been with the hospital for 13 years, and I've been in the community for about 25 years. And so the one thing I'd like to just really follow up on with what Dan said was that, the communities at large and the state, we've been working together and planning for these types of things almost every day, every week. Think of every time we test a system, we do an alert as a test. All of the events our communities have lived through, we've really been working up to this moment. So even though it was just about 4 weeks ago that we set up our incident command, that was just the time that we started very, very much dedicated time to planning the COVID response. And since that time, we've worked daily with the state, the Division of Public Health, with the City of Homer, with the Kenai Peninsula Borough, with DHS. And, that's been so rewarding that we're not an island on our own. We are a part of a Southern Peninsula response. We're a part of a Peninsula response, and we're a part of a statewide response. And that just, it pulls brain power, it pulls systems and resources, and it makes all of us stronger when we work together like that. And that's been so impressive to watch and be a part of, and to say, help, because it's okay to ask for help, because somewhere in that group, somebody's going to have the resource or the power. So that is just made for easier lifting as an overall response plan.
Got puppies.
So we're forever grateful for our partners, but we're forever grateful for our incident command team and our staff, because our staff is really just working day and night right now to make sure that this hospital is ready to walk with the community on this journey. The incident command focuses pretty much on these 5 areas as we meet and plan: testing, patient care, patient services and care, alternate care sites, staffing, and safety, whether it's staff safety, patient safety, and all of the supplies and equipment that go along with that. So that's kind of been our focus over the last 2 weeks, is those particular areas, and teams working within and tiers within that to help get us ready for COVID-19. So I'm happy to answer any questions.
That is a very good introduction into what I think a lot of folks have been asking is, in that preparation, how is this going to help prevent or slow the spread as it relates to the hospital? Where are you guys at in the process now due to the patient reports or the cases that have been in your area?
Okay, so up until this weekend, we have been pretty much in planning stage. We did start testing 2 weeks ago, but other than that, most of our work has been planning until this weekend. And this weekend, we took all those plans and we moved into action. And so some examples of that is that we had already scaled back our services, but this weekend we closed some areas, we relocated some areas to free up space in the hospital itself. So for example, we moved our physical therapy unit down to a separate building. We moved our infusion clinic down to a different building, so that those patients and staff could have their own isolated area, if you will, to protect staff and patients, because some of that care has to go on as long as possible. So we also started ramping up all of our fit testing, PPE allocation, getting everybody trained in using those, all of the equipment, clearing out space, testing equipment. And one thing that we've worked a lot on over the last couple of days is reassigning staff. So as we scaled back services, those elective procedures that don't need to happen right now, as we scale those back, it frees people up to be available to help specifically with COVID-19 response. So we've worked hard over the last week, and especially just in these last few days, of assessing people's skills and talents and plugging them into some of the new needs and newly defined positions specific to COVID-19. And it's phenomenal, because you can work with people for years and you see them maybe as the job that they're in. And then something like this happens and you realize, oh my gosh, they have 10 years of experience doing something else. And now we can take that expertise and plug it in a very meaningful way. So that's just been very rewarding for all of our staff to get to raise their hand and say, I can do that. Or sometimes maybe I can't, but I'm willing to learn that for this. So some other things we've been doing is just kind of working on our systems and our protocols and our guidelines so that we are ready as much as we possibly can be to treat and care for patients with COVID-19. Remember, we have a lot of we have a lot of hurdles in our way. We have a supply chain in the United States that has somewhat crawled to a stop. And, you know, we don't necessarily as a state, we don't have an overwhelming number of beds, if you will. And so there's some hurdles that are in front of us. But given all of those hurdles, I think that the team has really positioned us to do the best we possibly can, given the situation that we have. So in answer to the question about like what we've seen, so we have been testing. We opened up our drive-through testing on the 12th, and let me look at my numbers here. So since the 12th, we have done 54, we have sent in 54 test samples for testing. And we send both to the state lab as well as to the commercial lab that sends them out of state. And we have received, from those 54, we've received 37 negatives. We've received 1 positive, and the balance is still pending. So folks need to know that this is not like an Insta swab. You don't come and get tested and you have the result that second. It's the kind of thing that takes time because we do have to get them processed. I will say that we are committed to expediting as much as we can. And effective this morning, our lab now personally drives all of our tests to Anchorage. They leave at the crack of dawn and they get them up to Anchorage so they can be included in same-day testing from the state, because we want to eliminate any delay that we possibly can in getting those test results back. Our lab also, we use a system and equipment that is called BioFire, and that is an internal piece of equipment that we use for some rapid testing of other needs. And our understanding is that they just got FDA approval to do COVID-19 testing. And so we are on the list to receive the test kits to be able to process them here. Not sure when that might be a few weeks, might be the end of April, because some of the areas that have higher caseloads are being prioritized, but we're hopeful that that will come in a meaningful time. I feel like I gave you a really long answer to that question. So
That's all right. One of the, I think I'm getting lots of feedback here. Hold on just a second. Is that better for everybody?
it was fine for me.
Okay. One of the things I want to go back on is the connection between the local jurisdiction, the borough, and the state. And I'm going to ask Dan also to help contribute with this understanding when it comes to planning, and also to understand that that is a connection that includes our unincorporated communities on the other side of the water, as well as Seldovia is also a municipality, in the event that we have an individual that needs to be transported. And Dan, I want you to jump in and talk about what is that plan that's in place that you helped the city, but also that we implemented as a borough to help our unincorporated communities that are across the water, to get them over to the hospital if that's needed. Could you share that with us, please?
Absolutely. So we know that in normal times we have a lot of different mechanisms where we might be able to bring patients to a medical facility from an isolated area, whether that's usually talking about aircraft, whether that be fixed wing aircraft or helicopters, medevac transports, and those types of things. So as we look at some of the transports that are generally used, especially down in the Kachemak Bay area, well, there is a lot of medevac and those things. For those less urgent cases, you might see just normal commercial aircraft that do the charters and do the regular runs to and from those communities and other communities across Kachemak Bay and Cook Inlet. So we've worked with them a little bit as those carriers, now that we're dealing with new CDC protocols with enhanced guidance. Everybody is doing, their enhanced disinfection and those types of things. So with the cooperation of the city of Seldovia, as well as many of the other villages and communities, South Peninsula Hospital, we put a few alternatives in place. So if we aren't able to utilize commercial carriers, if perhaps the patient has got a higher need than maybe just providing transport, we've been able to put in some pre-plans and protocols with some of our medevac providers but also some of our water taxi services and also some NGOs, some non-governmental charitable organizations that have aircraft and logistics assets have all stepped up to the plate. So what we've established now is essentially a priority list. So if we are not able to get that normal piece of transport, we've got a few alternatives so we can get those people over to care as it's needed. So these things are put in place, and they're really put in place with the cooperation of both the cities and municipalities, but also with the air carriers and with these charitable organizations as well. So it was really a great planning effort and a great effort that everybody came together and really was able to solve the issue and make sure we have that when those communities need it.
Yes, and that is going to be a great segue into those alternative hospital accommodations, alternative care sites that we're also working on that plan as well. Could you describe that a little bit? And then I'm going to bring it over to Dorotha for what they have in place.
And Dorotha can definitely address some of the specifics. So an alternate care site is a term we use a lot, and essentially what that is to boil it down in a nutshell, it's additional capacity for our healthcare facilities, for our hospitals. So we've heard it talked about, that and this is one of the things that I know we're planning for. I know all of the hospitals' incident command teams are planning for this. Is we're really planning to make sure that we don't have an adverse impact on our healthcare system. That patient surge, that all of a sudden with a higher number of people than we have capacity, whether that be beds, whether that be physicians, to be able to care adequately for all of the patients. So when we talk about an alternate care site, that's a plan that employs a different facility, no matter what that type of facility may be. It could be, as folks are saying in Anchorage, the stadium, the Alaska Airlines Center is being used. It could be a school, it could be a church, it could be a gym, or it could be recreational. It doesn't matter what it is, but it's a site that we have a plan to assist our hospitals in being able to get the logistical needs, all of their medical needs, and staff to be able to take care of either overflow patients or potentially it's something where maybe patients that have this type of illness would go to the alternate site, so the main hospital is able to care for what we call those routine cases or those day-to-day things. So it sounds like a very simple plan. It is not exactly simple in execution with all of the details and the medical requirements and making sure that it's safe for patients and safe for the staff. But that's really what we've been working on. And we kind of talk about that long-range planning as we kind of are in different stages of that in different communities, but being able to make sure that it adds a buffer. It basically adds some more capacity to our healthcare system so those folks in the healthcare business can take care of us. So I know that's a very brief overview, but I'll let Dorotha fill in any details on that and anything specific that their team's been working on, because they've been working hard on it.
Yes, well, Ms. Dorotha, please.
Yeah, perfect timing, because today was a big day for us in that we actually started moving into our alternate care site for patient care related to COVID-19. So the way that the state has, the suggested plan through the state is that patients will have unique areas based on their level of the disease. So based on kind of where they are, mild, moderate, urgent, or severe. And so most mild cases will probably be sent home. They won't be in a hospital. They'll be sent home to care for themselves at home, self-quarantine, because their symptoms are mild. Somebody with a moderate case, then they are the folks that will be sent to our alternate care site. And our alternate care site is the Christian Community Church. And it's right at the bottom of Bartlett Street. So it's just a few blocks away from the hospital. And it is 26,000 square feet. And it's very large. It has a huge gymnasium. It has locker rooms and showers and a kitchen and dining area. And I mean, it's just this phenomenal, just picture a community center on steroids. It's just so perfect for this type of situation. We had signed a memorandum of understanding with the church, at least 6 or 8 years ago, and had kept that active, and was so grateful that we'd done all of the work so that it was ready for this. So we actually went down and started moving in today. And again, this is where patients that are at a moderate level would be cared for. Individuals who are more urgent and need a higher level of care, they'll be in the hospital. But because we've relocated so much of the hospital services elsewhere or discontinued them, we have a lot of extra room in the hospital. So we could be able to treat as many as 50 patients in the hospital itself for the more urgent cases. So I'm going to show you a picture, if you don't mind, of what the setup down at the alternate care site. That, again, we just started today, but I'll try to hold it up here. How's that doing? Can folks see it, you think?
Yeah, they can. That's good.
So that's just kind of 2 patient areas or patient rooms. And so and it's great because it's fairly walking distance if the weather's not bad, so that we can share resources between them. So that's the example of our alternate care site. But there's another example of alternate care that we will utilize during this, and that is with the emergency department. So because we're anticipating that COVID-19 patients might be coming through the emergency department, effective today, we have opened up an urgent care, if you will, at Homer Medical Center, which is traditionally our primary care. And so we have opened up an urgent care, which will allow some of the lower level ED visits to be able to go down for urgent care at Homer Medical, to be able to limit the number of people coming to the emergency department. Now, if and when you do come to the emergency department and you're not here for something that's related to COVID-19, the rooms in the ED are separated so that there's rooms that are COVID-free, if you will, and rooms that would be used for treating somebody. And calling first would be very important. You've heard it over and over and over again, call first, call first, call first. But it would really, really make a difference. That way you're not surprising folks as you kind of arrive. So that definitely makes the difference. So 2 examples of alternate care sites for South Peninsula Hospital.
I want to ask you a point of clarification. If I was to call the hospital and say that I need to bring someone in for care to the emergency room, should I call your local dispatch 911 or should I call the administration line? What would you recommend if someone needs to bring someone into an emergency room?
0235. So we have a line set up, 235-0235, and it goes indirectly to the triage nurse at the ER. And so that is the phone number that we're also using for our drive-through testing. So I'll start with the drive-through testing and explain that. Drive-through testing still has to be physician referred. And so if you're feeling sick, you call your physician. They do some screening on the telephone. They ask you certain questions about your symptoms, about where you've traveled, if you've been exposed to COVID-19 to the best of your knowledge. They talk about your health history. And then once they gather all of that, they screen you on the phone and they say, you know what, I'm going to send you up to the hospital for testing. And you drive up to the front entrance of the hospital, but you never get out of your car. And as you drive up, there's a big sign with a phone number, and you call that phone number. If it's busy, somebody might already be out in the tent waiting on you. But if not, they'll inside, staying warm for the next person. And so you call and they'll come out to a little drive-by tent, and you'll just do your swab right from your car. You don't have to get out of your vehicle. So that phone number is the same phone number if you're at home, really serious symptoms, you really feel that you need to visit the emergency department, then you can call that phone number and let them know you're on the way. Now, if you have very serious symptoms, certainly you can call 911, but I do have to urge you that if you call 911 and you are suspicious that the reason you're calling is related to COVID-19, please tell the dispatcher at the point of call that that's what you're concerned about, because the EMS, they are stuck in the same supply chain holdup that we all are, and they want to protect themselves as much as possible. So by alerting them in advance as to what your concerns are, and if you think it might be COVID-19, it helps us conserve supplies, but it also helps the EMS crew really, really protect themselves when they're responding.
And we have several people asking what the number is, and that is being provided in the comment thread as well.
Great. And I'm going to double check it.
Nope, you got it covered here. I see it on the screen as well.
Okay, good.
Yep. And the other piece of that, just coming back to the alternate hospital accommodations that have been set up. There was conversation online that the long-term care was going to be moved. Can you help us understand that better?
You know, I heard that and I have no idea where that came from. None of our options has ever been to relocate our long-term care. We are so fortunate that our long-term care is at the far end of the building. It's totally isolated from the rest of the facility. The staff can come and go out of their own entrance. It really is a pretty ideal scenario for such a high-risk, vulnerable population. So no, our plan is to definitely keep our residents right here safe and sound as possible. And it's always every day at our 1 p.m. meeting. It's an important part of the conversation is discussing the protocols for resident safety. And every single day, it's a very special moment every single day when I hear the state say, these are their new recommendations, and our long-term care says, oh yeah, we're already doing that. And so, I mean, our long-term care is just very, very proactive with their safety protocols in keeping the residents safe and healthy.
That's great. It's a great satisfaction, a verification of what those plans you talked about earlier are implemented now, and others are making recommendations you do, and you've already done it. That's outstanding work, just outstanding work. Let's talk a little bit about this local vendor who is making face shields for the community. Can you tell us a little bit about that?
Awesome. Oh my gosh. And that was just two folks. If it's the one I'm talking about, if it's the one I'm thinking of, they didn't even really know each other that well or anything. It's just somebody said, hey, I've got a 3D printer. Anybody have equipment out there? And boom, Nomar stepped up and said, we got some equipment. And they got together and started making these masks or these face shields. And I'll tell you, that is one example of just the incredible outpouring of offers from the community to do something to help solve this, to help protect people, whether it's home-sewn masks, home-sewn gowns, home-sewn caps, supplies out of people's closets. HEA donated N95 masks to us. The college gave us stuff that they were using for their nursing program. I mean, everybody is just being so generous and so resourceful and creative with their abilities, whether it's their business or whether it's their personal. And because of the outpouring, it's been overwhelming to manage everybody's offerings. And so back to the beginning of our story, and that is everybody working together, and the city has stepped up, the city EOC has stepped up, and they are going to be the hub for the entire community for donated items and needs lists. And so anybody, whether it's the hospital or the grocery stores or the taxi drivers or the clinics, if they have a need that isn't being met through the normal supply chain up and down to the feds and back, then we put the call out to the local community through the city's single voice out to the community, and then the offers come back, funnel back through. So if you go to the city website, they have on their COVID-19 page, they have a button, and the button is want to donate or volunteer, and then they have another button that says have a need. And so all you have to do is if you're somebody who has a need, you click that and you type in what you need. And if you're somebody who has 2 cases of N95s or some painters outfits that are full I just lost the word, protective gear, whatever you have, then you can put it in the other tab, which is this is what we have, and if you have a need, you can put it in as a need. So
I also saw that. I just want to interrupt real quick and let folks know that I put that on the blog on the right-hand column under City of Homer, and that's an outstanding resource, so they can go right to the blog and catch the link that way as well.
Excellent. I want to give an example, because some people that aren't real involved in this, that maybe just are kind of doing their normal thing at home, they'll be like, who would have a need other than the hospital? Let me give you an example that I had this morning. A taxi driver called me this morning and said, you know what? I don't have anything. I don't have a face mask. I don't have hand sanitizer to wipe my hands in between things. I don't have Clorox wipes to wipe the seats down, because everybody's sold out. And what can they do? And it was so wonderful to be able to say, yep, go to this link, call this phone number, and you put down exactly what you need. And then the city has the funnel then to grab it and get it to you. Now the get it to you part, we're still figuring out, because it's very, very important, whether you're sewing masks or whatever role that you're going to play, making the face shields, whatever your role is, it's super important that it doesn't cause you to go out and about unnecessarily. So even though you might want to make face masks, if that means you have to go to the store to buy the material or the elastic or anything like that, please don't. Please, let's wait until we can have some other systems where maybe we can prevent you from doing that, because we don't want the efforts to lead to risky and unsafe areas and behaviors. So, but yeah, thank you for doing that. And to the group that's doing the 3D printer and making the face shields, just an awesome thing, not just for healthcare workers, but for grocery store workers. I mean, anybody. Some people are furloughed throughout the community and they're not working. Others aren't. They have to keep going to work because the grocery store or the gas station stays open, and you have to go to work. So it's wonderful that the ingenuity and the generosity is just really great.
Yeah, outstanding. I will say in the comment thread a couple of times, the question has come up. I don't know if you can answer it or not, with regards to the Veterans Clinic. It was moved, or can you give us a little bit of information on that?
You bet. Boy, for the last 7 years, the VA, Dr. Boone's VA clinic out of the Soldotna Kenai area, it actually functions in the hospital's emergency department. 2 of the ED rooms turn into that clinic on Mondays and Tuesdays. Every week we host the VA clinic. Well, now because of COVID-19 and the preparations in planning to be able to give best care, the VA clinic has moved down to one of the buildings down Bartlett Street. So that address is 4201 Bartlett Street, 4201 Bartlett. That's the VA clinic. I don't honestly know that they opened today. The intention was they were going to, but I did not drive. I work from home a good bit. And I'd like to talk about that for a second, that we have at least 70 close to 70 employees who are telecommuting. We're working at home. And because of that, I don't have my eyes on things. And, I'm in meetings and I hear things, but I wasn't here to visually see if the clinic was operating down there or not. And so maybe if we do any more questions, my friend at that clinic will text me that answer.
All right, thank you, Dorotha. I'm going to ask you if you have any additional comments, closing comments, or key messages that you want to share with our audience tonight as we wrap this up, and I'll give it back to Dan for closing comments.
Resources. Here, there's this great online symptom checker, C19check.com, C19check.com. It's a very advanced symptom checker. It asks your health history, your age, your demographics, your symptoms, and it might help you feel a little better, especially if you're home alone and there's nobody to kind of talk it through with and stuff. That's a great resource. Coronavirus.alaska.gov. So that's an awesome website that the state DHS has up for us to use. That's why it's there. People spend a lot of time loading materials, helpful materials on it. There's a section on the left that breaks it down to general public, healthcare, special groups. And so before you get on there and get lost, just go on and pick which one you are, healthcare, general public, or a special group, and then move in that way. It'll be a lot easier to navigate. And the city has an info line now, and it's the city line runs 6 days a week, 435-3197, and it is answered 6 days a week, not round the clock, but extended business hours. And great place to call if you just want to ask a question or clarify something. They've got a lot of information from a lot of different resources there. So call first if you are going to your healthcare provider and you've been exposed to COVID-19, you have symptoms similar, fever, cough, shortness of breath, please call. Do not just walk up to their door, please call.
Very good words.
Help prevent the spread.
Thank you so much. Dan, I'd like to bring it back to you for some closing words and some words of wisdom, if you will, from our IMT, our incident management team.
Thanks for that, Brenda. So Dorotha, thanks so much for joining us today and providing that perspective from the hospital and the healthcare side, and it really, a lot of good things are happening down in the South Peninsula, and it really is a true thing when everybody's working together and doing some of these things, and that's how we're able to accomplish it. And communities on the Kenai Peninsula are used to doing that and used to working together and being able to get these things done. So, of course, just so much thanks to everybody at South Peninsula and all the medical providers and doctors and nurses and technicians and everybody else that's helping to keep the healthcare system running. And there's a lot of people, if you go to any one of our hospitals, there's a lot of people that you don't think about that are keeping the place running. And of course, now even working from home and telecommuting. So thanks so much for that. I want to, again, thank you for coming in and joining us. It was a great conversation. I do want to let everybody know before we sign off that tomorrow evening here at 7 o'clock, we're going to be back, Brenda and myself, but we'll also be joined by Bruce Richards with Central Peninsula Hospital, and we'll talk a little bit about some of the things happening at their facility. So that should also be a very good conversation, and we'll have a thread up on the KPB Alerts Facebook page to get some questions on that. So if you have questions for Central Peninsula Hospital, please feel free to submit those. Remember, all the things we talked about tonight, the phone numbers and the links for resources down in the South Peninsula are all linked on kpboem.com. You can follow KPB Alerts on Facebook and Twitter for updates throughout the day as things change. So with that, again, thanks so much, Dorotha. Brenda, thanks so much for moderating this evening. And I'll wish both of you a great night, and everybody out there have a wonderful, wonderful night. And we'll see you tomorrow at 7.
Thank you.